Thank you. I love being referred to as an expert. Don't know if I can claim it, but I'll do my best. I think you bring
Awesome.
in such an important point because I think there is
Mhm.
such a spectrum when it comes to postpartum feelings. And it goes from baby blues to postpartum depression and even postpartum psychosis. And the
Mhm.
important thing is to know where you're at and when it is important to seek help.
All right.
Yeah, because baby blues are something that can fade, but if you persist and don't get the help that you need, it can really get difficult.
Mm-hmm. All right. Okay. I've never heard about postpartum psychosis, but we'll get into that a little bit. Let's talk about postpartum depression. What are the signs and symptoms that one should look out for in order to know where they're at?
Mm. Well, often people think that postpartum depression is less serious than depression, but it's
Mm.
not really. And actually, it shares quite a few of the similar symptoms. So we're looking at low mood, low energy, troubles with eating, either eating too much or too little, troubles with sleeping, with motivation. And then the things that really start to worry us as psychologists is around a difficulty bonding with baby, sometimes having hostile feelings towards your baby, not being able to respond to your baby's cries. So when it stops being baby blues and starts being postpartum depression is really about how much it is impacting on your daily life and how much it's
Mm-hmm.
impacting on your relationship with your baby.
Mm-hmm. I've heard about a postnatal depression. Is there any difference between the two?
No, there's no real difference that I know of.
Mm-hmm.
Yeah, I think it's pretty much very similar.
Mm-hmm. All right. So, what causes postpartum depression?
So there can be various triggers, so various things that go on. So often if mom has a history of depression, that can be something that we look at.
Yeah.
We look at mom's life circumstances at the moment during pregnancy, and we think about, uh, does she have support? What are the
Mm-hmm.
circumstances? Is this a planned or unplanned baby? Is it a wanted baby? Is it not? Mom's
Mm-hmm.
socioeconomic status. So there's a lot that goes into it. And I guess we're not saying that everyone who struggles will always get this, but it's always just something
Mm-hmm.
for us to keep in mind and think about.
Mm-hmm. Yes, speaking about that, can a woman who has had a history of mental health be at risk of getting a postpartum depression?
Absolutely. Absolutely. And
Mm-hmm.
again, not that she will, but it is something that we would want to look out for. And also a genetic predisposition. So if
Mm-hmm.
my mom had struggled when I was a baby, we would also be more cautious with you.
Mm-hmm. And what about men? Can men get postpartum depression?
So for men, we describe it as depression, but
Yeah.
absolutely, I think fathers are so often forgotten about. Um,
Mm-hmm.
so one of the main kind of predictors in terms of kind of helping moms manage depression is around kind of high paternal support. But we forget that the stress that puts on dads as well. And we know
Mm-hmm.
that men, there's often the social stigma. Are they allowed to access help? Where would they access help? And often the focus is so on the mom in those early
Mm-hmm.
days. The dads, yeah,
Mm-hmm.
can often be forgotten about.
Yeah, definitely. They do actually often go unspoken of. I was speaking to one of my guests earlier and about her experience with postpartum depression, and she mentioned, she highlighted self care and how important that is, or how that helped her. So, how important is self care in, I don't know if I can say, helping oneself get through depression
Hmm.
or a
I
postpartum
mean,
depression?
absolutely. I heard a part of her interview, and I was kind of nodding along because there's a lot that
Mm-hmm.
she described that feels so important. I
Mm-hmm.
think everyone, most people do struggle when baby is born. There's
Mm-hmm.
something about an identity. I'm no longer just a sister or a daughter. I'm also a mother myself. And
Mm.
sometimes it can be hard with the expectations that we put on ourselves for that. So there is something about definitely taking care of yourself, putting in boundaries if you need it, reaching out to your social support networks. Yeah, there's so many things that we really do encourage our moms to do. Make sure you're looking after yourself physically, even as
Mhm.
something as simple as nutrition, trying to make sure you're eating, you're exercising can have a huge impact on mood. But again, there are limits to that. There are limits
Yeah.
to how much you can manage on your own.
Yeah, speaking of managing on your own, for family members, friends, how can we help the mother or father who is experiencing postpartum depression?
I think the main thing would just be to check in, to offer for help, and to keep checking in. I mean, I think often the checking in and support is very high in the beginning, kind of the week after baby is born, and then it quietly disappears. And yeah, mums and dads may need a lot more support kind of later on as well. Checking in, making sure you're helping, buying dinners. I've heard of some people who really appreciated somebody sending somebody to help them clean the house. So it really does depend. I also know culturally, some cultures have what we call an umblizane period, where they'll have family members move in to help support. And just those extra levels of layers of support around baby are so important.
Yes, it is so important. And I've had that experience where my mom helped me out with my baby. But she wasn't there long enough to help me, and she was there while I still had the baby blues. So it was like, it's one of those things.
Yeah.
But yeah, it is very necessary, and it does help a lot. So coming back to the diagnosis, how is it diagnosed and treated?
So again, it would depend. It would depend on the person and how they're presenting. So if somebody is presenting more with the baby blues, then you would probably help them think about support.
All right. We have just lost Amy there. We're going to try getting her back on. If you have any comments or questions for her, please send them to us. You can send them in the comment section below, or you can send them to WhatsApp on 0617660355. We are talking about postpartum depression and how it affects oneself, how it affects the people around you, how it affects the baby as well. And this would also be interesting. How does postpartum depression affect the child? The child in question. Amy, we got cut off there, and you were talking about the diagnosis and treatment.
Yes. Yeah, I'm so sorry about that. So if you are worried, or even if your spouse or somebody in your family or even a friend is worried, what I would do is approach the mum. If it's not coming from the mum, then hopefully the loved ones would be able to reach out and help her find support. So you can go to your GP if it feels like it's more easily accessible. You can go to a psychologist if you feel like that's a possibility, or even your primary health care clinics. And there they will do an assessment and decide kind of what next. And it can be counselling and therapy, and it could also be a medication. And I heard what you were saying as I rejoined was something around what's the impact on the child. And the impact on the baby is definitely something that would guide how we would approach treatment of the mom. So at Ububele, we do parent-infant psychotherapy work where we work with moms and babies in the room. And that can be important to facilitate things like bonding. If you have a mom that is so depressed that she can't make eye contact with baby, is feeling very hostile towards baby, can't respond to baby, then often we do look at medication, because that very early attachment is so important that we want to shake something out of mom quite quickly so that she can quite quickly become available for baby. And then we will always also recommend therapy, not just medication, something supportive, something that will hopefully hold her.
All right. So now quickly tell us about postpartum psychosis, as you mentioned earlier.
So that is a very extreme case, and actually it's really not as common. I've only seen a couple of cases in the hospitals. And that's when it basically becomes things like where mom is outside of a sense of reality. So when a mom is undergoing psychosis, it can be things like delusions, hallucinations, sometimes not being able to accept that this is her baby or that she was even pregnant at all. And that's when it would have to be medication and often also admission to a hospital. But it's very rare. Luckily,
All right.
very, very rare.
Oh yeah,
Yeah.
definitely. I mean, as I mentioned, I've never heard about postpartum psychosis
Mm.
until now that you mentioned it. But thank you for
Mm.
bringing it up, because there might be someone out there who is experiencing something, or knows of someone who's experiencing this. Amy, would you like to share your contact details with our listeners in case somebody might
I
be interested?
would. Okay, so you can get more information on Ububele at www.ububele.org, or you can email info@ububele.org, or phone us on 011 786 5085.
Right. Thank you so much for your time, and have a wonderful day.
Thank you, you too.
Bye.
Bye.
That was Amy Shirley, the counseling psychologist who qualified from Wits University, and she currently works at the Ububele Educational and Psychotherapy Trust with a focus on babies and their caregivers. And she also has a private practice based in Linden. Ububele is, you can go to their website for more information, www.ubele.org. That's Ubele Educational and Psychotherapy Trust. You are listening to the Mid Morning Talk with me, Maryam Mkwanda. Do stay with us.